Good morning, Carbon County. Thank you for joining us for this month's COVID physician panel. As always, we will go through general information for your benefit, and at that point then we will open it up to questions from the viewers. So we do welcome viewer participation, and with that we're going to go ahead and get started. With us this morning we have a few new additions. We have Bill Minion, who is our manager of the surgery department here at MHCC. We also have Dr. John Lum, who is our general surgeon, Dr. Edward Zimmerman, Dr. Greg Johnson, Dr. Dwayne Abels, Dr. Stephanie Chu, and Dr. Charles Cunningham. So with that, we'll go ahead and get started. And Dr. Abels and Dr. Zimmerman, I will let you kick things off.
Well, good morning out there. We've had this meeting because unfortunately we've had quite a surge in our county. Our numbers per population now are close to matching the hotspots in our state, which was Fremont County, Teton County. And this is very concerning. It has spread, and of course from the newspaper you all know that the governor had started testing the penitentiary. And of course, we were always concerned in this confined population, as well as the fact that people work there and then go home, and it can spread through the community. But that was not the only focal point of this outbreak. There was also a couple of other outbreak areas, so it's not just the penitentiary, that have occurred in this. And so all I can say is when I go out in town to the store and other places, I certainly still do not see enough masks, even though the stores have done a real good job of pushing for the masks. But I still see people arguing about putting on a mask. And this is not considered of your fellow man and woman in this, and kids in this county. These masks don't protect me, they're there to protect other people. So I strongly encourage you, we need to be more vigilant. Large gatherings, all these things are a risk. The demolition derby pictures were a demonstration of crowding and no masks.
The current surge started around August 1st. This is really loud. We had a big surge from August 1st to the 5th, and then it kind of started dwindling back down, but still we're over 500 active cases a day in the state. So more than where we were. In the University of Wyoming, they had 34 cases from their initial screening, and they're still coming in on the screening they did. They had 2 in the residence halls there. Everyone's going back to school, so we know we're going to see a surge there. We know that children, even though they aren't symptomatic from it, are super carriers. They spread it a lot. And so our younger children will be spreading it to their families when they take it home. So we're expecting a surge as school starts. And it's expected, and we know it's going to happen. But I noticed that like in the elementary schools, the kids are really, really good about wearing their masks, and they follow rules, and they're really happy about it. And then you get to middle school where they're maybe too cool for the masks, and maybe they don't wear it quite as much. And then it actually improves a little back up into high school. So anyway, encourage your students. A lot of them, how they manage wearing their masks will depend on how they're talked about at home. So if you're really anti-mask and they're poo-pooing the whole thing, your students may not want to wear their masks, and it makes this worse as we send our kids back to school. And all the memes you're seeing, the anti-mask memes, I would love to refute those. Anytime you see a study from 2016 or 2018, it's not really relevant for this virus. So most of them were done with flu virus, and how the flu is transmitted in droplets and how this new virus is transmitted in droplets is different. And so now we have really good evidence showing that masks are more effective for this virus than for previous. Even though there's old studies out there, and you'll see them coming up on the internet and on Facebook all the time, you can pretty much disregard them. It's old evidence, and it's been refuted. So.
Okay. And then, so I didn't know if it was something that we kind of wanted to jump into with the inpatient cases also. So I know that's always a big question, is if we had any inpatient cases of coronavirus. We did, along with the surge, we did have several cases every day for about, 2 weeks. We had about 2 to 3 cases that were positive. We had a great team though of doctors everywhere from the emergency room to the hospitalists, who were taking care of these patients. And they all did really well. There was only one that was a little bit sicker than everybody else, who was getting close to possibly needing to reach the stage of intubation. And with that though, he didn't end up needing it. But if he had, we were all very well prepared. We have a great solid team, you know, in terms of, you know, with our CRNAs, who would be doing the intubation, our management, having the ventilators ready. We had all of that set up, so if this patient had deteriorated, we would have been set for that. So it's one of those things that, you know, even though we're a smaller hospital in Casper than Cheyenne, we are very prepared. We've had plans set up, you know, our nurses, our staff, our doctors are very well trained. Everybody's very well set up to take care of the surge. Of course, that doesn't mean we want to have 20 people on 5 ventilators, so we still want to, you know, emphasize the importance of social distancing to flatten that curve. However, you know, rest assured that if something were to happen, we have a great team that's ready to take care of our patients.
So not much has changed as far as treatment recommendations with COVID. We still have a lot to learn, and hopefully new treatments and vaccines will be available. So the primary emphasis still has to be on trying to prevent the spread. And that's something that every member of the community can participate in. So it's real important to wear the masks. If you're not worried about yourself, being a team player in the community, and if we're all in this together, we can certainly make a difference. There's certainly a huge concern with the starting of school. We don't know how that will play out, but there certainly is a risk for a significant surge, just due to students getting back together in sports, whatever they're doing with that.
It's been a little bit since I've been on one of these talks. I missed the last one or two, I think. Not a whole lot has changed on the OB unit since I was on here last. Probably one thing that has changed is we're now doing the rapid screen on mom and the support person when they come into labor or when they're admitted. We've had a few of my patients that have tested positive for COVID, but luckily not very ill. And so that's kind of an update from the OB side of things. Not a whole lot's changed though.
Okay, so from a surgical perspective, Dr. Lum and Bill Minion, MHCC has implemented some precautions and some guidelines surrounding general surgery. Can you speak to that a bit?
For all of our surgeries, we're testing all of our patients that come in for COVID prior to the surgery, and as close to the date of surgery as possible, because after they're tested, we're expecting them to self-quarantine, which means you stay home and not out in the community to limit your risk of exposure. We have protocols in place. If a patient does show up, does test positive, anesthesia has developed a cubicle for them to intubate the patient, and then we have all sorts of protocols in place for cleaning afterwards to make sure that if any virus were left in the room, it would be removed before we were bringing any other patient in.
Okay. Dr. Lum, do you have anything you'd like to add to that
No,
from a surgical perspective?
Not really. I mean, we're still doing elective cases, but we are taking these precautions, and everyone's still coming to the hospital, expected to wear a mask and be escorted through the hospital, so we don't have people roaming around. We're limiting the number of visitors that can come in and that sort of thing as well. So,
And we're also limiting where visitors are able to stay while their loved one is having surgery. We aren't allowing them to go into our waiting rooms. Again, we don't want to have groups of people sitting in areas possibly exposing one another. The cafeteria has been closed, so it's limited to one visitor per patient. Again, for the safety of the patient and staff and the families.
And if we have an emergency surgery, Bill emphasized, we presume any emergency surgery is positive COVID, and we do extreme deep cleaning of that room and all instrumentation.
And we try to limit exposure as well, so if they're coming in as an emergency or it's a patient we have to do surgery on that's tested positive, we change our protocols a little bit, that the patient will be doing the recovery in the ORs, they're going to the recovery room. It's just to limit exposure throughout the hospital.
Okay, thank you. And for those of you watching, again, there is a full list of all of our visitor restrictions listed on the MHCC website. So we do encourage you to please take a look at that prior to coming into the facility. Okay, so we do have a question that came in, and we've talked about herd immunity in the past. Would you please explain why herd immunity is not a good thing for COVID, is coming from one of our viewers.
Actually, herd immunity would be a good thing for COVID. It's difficult to achieve. When they went back and looked at New York, where it was really thick as far as number of people, the antibody testing did not show we were even close to getting herd immunity. So it will probably require a vaccination program to do that. And just to clarify, people are wondering why a vaccine would work when getting the virus doesn't. It's just because the antigen that you're reacting to in the vaccine is very specific. And so you get a really wonderful immune response to the vaccine. The one you get to the virus is there, but it just doesn't provide enough antibodies. So measles is another version of it. There's some other viruses out there that if you get the disease, it still doesn't give you very good immunity. And so this is another one where you'll have to have a vaccine probably to get a good immune response.
I think it's a dangerous mentality. A lot of people think that, oh, it's just inevitable that we're going to get the virus, so why don't we just go ahead and have a party and all get it right now, and then we'll be done with it. I think that's a very dangerous philosophy. I think it's just a matter of being patient and waiting for the immunization, and then we get herd immunity from that, as opposed to the mortality of the people being exposed to the actual virus. I mean, there's going to be a lot more fatalities that way. So I don't think it's inevitable that we're all going to get it.
Like when I was a child with chickenpox, if you got chickenpox, everybody gathered, so everybody got chickenpox. But the mortality rate of chickenpox was extremely low. This mortality rate is not low at all. It's very high, relatively speaking, as for viral diseases.
And along that same line with, say, with chickenpox, if you built immunity to that, that was much more long-lasting. The last report I've read as far as COVID is that you'd be protected, if you were infected with COVID, you'd be protected for 6 weeks. But they couldn't predict beyond that what your natural immunity, it was protected beyond that period of time. So that's pretty dismal statistics.
Like I said, there's other viruses like that we already know. I mean, measles, you can catch measles more than once. It doesn't give you long-term immunity if you had it. That's why we have to have the MMR. So we'll probably have to have a vaccine for this one too.
Thank you. What is a viral load and how does it affect test results?
Want that one, Dr. Zimmerman?
Sure. You know, the viral load, obviously, if the people we're screening that are asymptomatic, their viral load is probably very low. It's actually the actual number of viruses that are there, and we have to have a certain number of that protein to be able to detect it. These are RNA tests. We actually have to have some of the virus present. So people that are really sick, it's easier to diagnose those people because we're for sure going to get a good sample and get a good positive rate there. The low viral load, it's more difficult to screen these people. So.
And the higher the viral load a given patient has, increases their contagiousness. That's the reason you read about the super contagious people, the super spreaders. They have billions of viruses instead of millions of viruses per milliliter.
Do we know yet how the vaccine will work? And what percentage of our population will need to take it to have a decrease and really make an impact?
We don't know. There's 5 of them in 5 of them that I know of, not the Russians, they've already done their own thing, but there are 5 others that are maybe a little better controlled. They're in phase 3. I don't know the details of them, and we don't know what herd immunity is going to require. Unfortunately, I've seen surveys where they said that only half the population was going to take the vaccine in the first place. So if we really have that level of resistance to it, we may not achieve herd immunity. So I hope everyone can educate themselves on vaccines and feel comfortable with this one once it finally comes to market.
And certainly I'm not epidemiologist or anything like that. The things I've read, though, we have to have a vaccine that would confer immunity at least about 65% of people that get it to a good degree. And then we would have, at that level, we would have to have 75 to 85% people take the vaccine.
And one more clarification, people say that you look at the flu vaccine, it's not very effective. It's the flu changes a lot every year. And so it's kind of a guessing game when they do that flu vaccine. So if we get a 30 or 40% rate of protection, that's actually considered a success. This should not be like that. This should be a much more finite group of people that we can treat, and we should have better immune response.
And even with the low results of the influenza test, if you do get it, you still get partial immunity, get less severe, less hospitalizations, and even with a vaccine, it's only 40% like influenza, the death rates from the influenza have always been lower than before we had the vaccine.
And even if it's not a good match for this season's flu vaccination, for whichever virus comes out, it could be next year that you have a little bit of partial immunity. So that's why even if we can't predict exactly what the right one is for this year, that doesn't mean it's totally wasted and there's no point. You still get some immunity to other future flu strains.
And the infectious disease nurse that's worked here for many years with me knows that I've always gotten my influenza vaccine every year.
And some of our flu vaccines have been like 80% plus. I mean, there have been some years where they've been right on. So it's worth getting.
And just to reiterate with that as well, some people, I think with the COVID, when they come out with the vaccine, it will not be a live virus. It would be very unlikely that anybody's pursuing that. With the influenza vaccine, every year there's people that I have discussions with that say that they get the flu every time they get vaccinated. And that's not possible with the influenza vaccine. You can run low-grade fevers and feel cruddy for a day or two, just because of the stimulation of your immune system, but that is not getting the flu or getting the influenza. And if the price that you're paying to get, after the vaccine, if you're mildly ill for a couple of days, that's much, much less than getting the true influenza and being sick for 4 to 6 weeks and getting COVID that is even more potentially life-threatening.
And the thing with the COVID, especially with young people who were talking about having the parties to get the disease, there's increasing numbers of young people with symptoms for months after recovery from the COVID. So this is not a benign disease, even in young people. And in fact, this recovery of long-term fatigue, memory loss, etc., is higher in young people from the studies that we got currently. So this is not a benign disease, even if you survive the disease.
I just saw a study where they saw with an electron microscope actual viruses in heart cells of myocytes.
And then, I mean, this is just a little side note, but if you do end up getting sick-like symptoms after you get the flu shot, even though, I mean, you still feel kind of cruddy, rest assured that means your immune system is working really well and you're really getting a good immune response where you're getting a ton of antibodies to that vaccination. So even though I know you might feel cruddy, kind of see that silver lining that this means you're going to be really immune and that if you do get exposed, you have a much lower risk of even getting a partial, muted flu illness. You probably just won't get it at all.
And in fact, after my flu shots, if I did not get a good reaction, that bothered me.
Can get the strep, flu, and COVID at the same time, will the hospital and clinic providers be checking patients for all three?
This is a clinical decision. Randomly checking all three tests at the same time leads to false positive and false negatives, number one. You have to use your clinical judgment. But in theory, you could get all three. It is very uncommon. We are very much more concerned about influenza and COVID being common because we have no data on that. And that's the reason that we're strongly pushing so hard this year to get influenza shots. Because if you get both of those and COVID weakens your immune system, you're more likely to get flu on top of it. And we were very afraid mortality rates are going to go up.
And our state lab is now switching. We just got that handout. They're going to be switching, but they'll be checking for flu. There should be a viral panel that'll include influenza and COVID. So they're preparing.
And the state health department's preparing in such a way that they'll do it off of one swab so you don't have to get two swabs.
Okay, so one of the questions is the CDC, says that our COVID numbers should be decreasing. Is that true, and why?
I haven't seen where it said they should be decreasing. I mean, if everyone was doing what they were supposed to be doing, well, we would expect to see a flat curve on the curve, but I don't know about an actual decrease at this point, especially with colleges going back and schools going back, and I would be surprised if we saw a decrease at this point.
I've never seen anything from the CDC stating that. But I didn't read that this morning. I guess there was comment in the
In the
background.
last 24 hours, I saw that the numbers in the hot spots like Florida and whatnot have decreased somewhat, so they're expecting the fatalities to start diminishing. They didn't really mention places like here, where, out west, you kind of have some social distancing anyway, but I am scared that our numbers are going to be increasing here, and you can't really use their statistics for this location.
Yeah, and the numbers they're talking about decreasing means they're decreasing. But if you'd actually look at the gross numbers, it's still very high in those states. Arizona's markedly decreased, but it's still way too high.
So in Wyoming, for example, and our governor has increased the number of people that can gather together. Is this because we are safer now? What are your thoughts there?
Maybe I disagree with the governor.
And also we know that outside gatherings, the risks are a lot lower, and so he's kind of following the statistics there a little bit, but he has a lot of pressure from other groups outside of epidemiologists.
And we understand that this is a lot of decisions that have to be made. Because even in my second meeting here, I was greatly concerned about the unemployment. I still am greatly concerned about the unemployment. So I understand that we have to get people back to work and getting things squared away. But I think it has to be walking the balance beam on both ways. So I did not agree with 250 people. I thought 50 was better. But that was a decision made, and we will try to adhere to that.
And I feel like it's all in moderation. So, for instance, I have a newborn son, and I'm not going to see my in-laws for 2 years, however long this is happening. Probably not. I understand, though, that anytime you get around somebody else, you're going to have a higher risk, but it's all about moderation. Am I going to go to a house party that has 40 people all crammed in a house and nobody's wearing masks? No. But, at the same time, are you going to have some social gatherings where you try to social distance, you wear masks if you can't? Yes, I do think that there's moderation here, and, I work in the hospital, but can I social distance from my son for 2 years? No. But do I do everything I can to mitigate my risk, to decrease my risk that I bring it home, where I go home and everything I'm wearing, I take off, I wipe down, I clean everything, I wash my hands, I wash my hands again after I've wiped everything down? Yes, so it's one of those, you do everything you can, and then you understand certain things might increase your risk. Like every day I go to work, it increases my risk. Every day that, I'm around somebody else, it increases my risk. But knowing that if we do everything we can to decrease our risk as much as possible, that's really what's going to be the most important thing, to not have these spreads of coronavirus.
For those of you that have been following this or watching, you know that things have changed significantly as time goes on. And even though they're opening up schools, letting some sports participation be allowed and such. That doesn't mean that that's set in stone. If things get significantly worse, they'll backtrack and potentially change that. Potentially close schools, put more limitations on businesses again. So, only time will tell.
And remember, when the governor does these proposals, each county, state health department though makes the final decision, not the governor.
Thank you. All right, and a question from one of our viewers is, can you tell us a little bit about the 20% that do require hospitalizations? You touched on it briefly, but people don't fully understand that death isn't the only thing to worry about.
So, for instance, of our patients who were hospitalized, several of them had, one of them developed complications with his heart, an arrhythmia that required IV medications. Some of them end up having what's called peripheral neuropathy, where you can have like numbness, tingling in your fingers, feet, things like that. So that's kind of part of the 20% that we're talking about. It's not just lung issues that kind of go away after you're done with it. You can have long-lasting, like Dr. Abels mentioned, fatigue, memory loss, your cognition isn't as sharp. So there are a lot of other complications that come with it. You're at higher risk of blood clots when you're hospitalized, and so these are all the things that we get worried about, not necessarily that you were hospitalized for 2 days and then now you're better, but that you're at higher risk for other complications and other body systems.
And that 20%, because of the inflammatory syndrome, blood clots are very common, unfortunately. And that's what's increasing the death rate of this disease, not the pneumonia necessarily. But these patients come in, they're low oxygen, they need oxygen, they need help, they need IVs, and Dr. Chu has successfully used the recommendations of the dexamethasone on our two sickest patients and prevented ventilation, in our opinion. And this is based, so we're using these things. And we do have remdesivir here, and we use that also. So we are using what the CDC is saying we should be doing.
So with that, what are some of the after effects of being on a ventilator?
So there's a few things that can happen. There's something called ICU delirium that, as you can imagine, after you've been intubated and you wake up and it's 5 days later and you have no memory of it, it can be very confusing for patients when they wake up. That usually luckily ends up being a little bit more short term. However, there's also a lot of weakness that comes with it. Think about, the last time you had the flu, you were stuck in bed for a whole day. You lose about 10% of your strength every day that you're not up, moving around, and you're sick. So you can imagine somebody who's been hospitalized for 5 days, losing 50, 60% of their strength by the time then they're not intubated, they can get up and move around. They're not really going to be able to do that. They're not going to be as strong. So with ventilation itself, it's more of the strength, more of the confusion that can happen. Also, just anytime you're ventilated, you're at higher risk of any other kind of inflammatory thing. So you'd be at higher risk of blood clots, like Dr. Abels had stated. Also ulcers in your stomach, which is why we do everything we can to give specific medications to help prevent that. However, even with that, people still develop these complications. And that's just the ventilator side, not even just the long-term effects of COVID specifically.
Because these ventilator complications Dr. Chu was covering occurs when we do treat them with pneumonias, sepsis. All these other patients that get ventilated have the same complications. This is not exclusive to COVID. So we always try to avoid ventilating patients unless we absolutely have to for that reason.
Thank you. What is the saliva test, and is it accurate? Will the hospital be getting that test?
The saliva test has not been approved completely yet.
I think there was a few.
It was the one test, yes, one test was. And the one test I have reviewed that was not approved yet, so I do not have you any comments on that? So the saliva test that I saw was going to be designed to be a home test. It is not as sensitive as these tests we're using. Sensitive means how well it says you got it, you don't have it at this point in time, etc., based on the load of the virus. Specificity says it's that virus. So this test, quick test, is good for saying that's the virus when it's positive, but it does not pick up the disease as early as the other sensitive test. But it is a lot cheaper and could be used at home in theory.
University of Wyoming did that. Every student coming in got a vial. My daughter was one of them. I had to fill it up with saliva and send it back in. So as far as a home screening test, it's about all we have for home screening because no one really wants to collect their own nasopharyngeal swab.
No, and so the idea is that we could use this $2 test, that's what they said in the release. I doubt it's gonna be that cheap, but if it is, that's good. $2 test at home, so that you would be able to go to work, send your kid to school, and if it's negative, that would less likely to make anybody else sick. If it was positive, you stay home and quarantine for 14 days to prevent the spread of this disease. That's the theory behind it. So if you have any more data on the sensitivity on the new test that was approved, I couldn't find anything. Sorry.
And UW picked up, what, 34 as of yesterday? I mean, it's picking up some.
So with the colleges, and many of them are requiring some sort of a swab or result before students go back into the classroom. Is anything, Dr. Chu, I'll direct this to you, is the clinic, is there any thing that we're offering specifically geared towards those college students?
Yes, so we are doing COVID testing for college students. That is something that, we've set up our advertising, our marketing, that we should be able to accommodate you. You just go ahead and call into the clinic. It kind of works the same for like airplane travel, things like that, where you call and just know though that unfortunately, because it's not something where somebody's sick or had contact with a COVID positive, if we get a surge, we unfortunately do have to put those swabs off just because, if we only have enough resources to swab a certain number of people. The ones that we're going to need to swab first are the contact tracing ones, the patients who are symptomatic, acutely ill. And then, of course, then we want to serve the community to be able to do the college swabbing and also doing swab for COVID for travel. For instance, like Alaska, you need to be able to have a COVID swab that's negative before you go into Alaska. So things like that we're setting up at the clinic to be able to help better service the community.
So you're doing like an appointment?
Yes, an appointment. So you call the clinic and then they set up an appointment for it.
I've been told Hawaii actually requires an RNA test, so even though a rapid test would not work. You would actually have to.
Same with New York too, isn't it?
Yeah, I don't know. I just know I've heard of Hawaii though. So be careful when you travel about what kind of test they accept. They may not accept the rapid test like we're able to do.
So if you have symptoms, should you be tested right away or wait a few days?
If you're symptomatic, you're probably okay. If you just got exposed, testing in the first couple days after exposure may not be very helpful. But if you're having symptoms, it's okay to go ahead and get tested.
Even with the symptomatic, if you have mild disease, the peak result is at 5 days for accuracy.
And remember that even if you're in quarantine and you get a test, even if it's negative, you're still in quarantine. You can't test yourself out of quarantine. And unfortunately, if you're quarantined with your family and then you turn positive towards the end of the quarantine, then you're stuck another 10 days on top of that. And you can be out 2 or 3 weeks if it just times out right for you. So
All bad for the public.
Can you explain testing wastewaters for COVID, and what is the purpose or advantage of doing this?
So it was very interesting. They actually did that in Yellowstone, I think was the first place that I saw, because they originally didn't think they had any cases in Yellowstone, but when they tested the wastewater, because you actually shed a lot of RNA of the COVID through your stools, so what they were finding was there were a lot of people who either had mild disease, didn't realize they had COVID, or were asymptomatic, who actually did have it. So that's why they test the wastewater, because then it's proof that, people are shedding this in their stool, which actually it's something I never would have thought about, but when they were doing it, I was like, that's actually a really great idea. I mean, that's a pretty innovative solution to this whole process.
And it's kind of epidemiology to see the prevalence of the disease in the general population. I don't know how it gives exact numbers, but that's the theory behind it.
the only municipality I know that did that, Cody, Wyoming did that in Park County. But that's all I know of that actually used that outside of Yellowstone.
Okay, so from an employment standpoint, is it helpful to have an employer ask for a negative COVID test to return to work after having the disease?
No.
No,
As in, we will not test, if you've had it in the last 3 months, we will not test you again. The chances of you being positive from residual antibodies or antigens is still there, so we do not retest if you've had it.
and even if the positive, everything we know at this point in time, you are no longer contagious. That's the key.
We still have employers sending people in for that,
Yeah.
but we just have to do some education that we don't retest if you've had the virus.
Okay, so going into fall and we're approaching flu season, when do you recommend that we get our flu shots this year?
As soon as it comes up.
That's usually the advice as soon as we
And
can.
do we know when that will be available?
October. Yeah, if you get them early and we have a late season like we've had in the last couple of years with influenza, your immunity kind of wanes from the vaccine potentially. So October is what they recommend. I've always gotten mine in October for that reason, because that's the best coverage.
Okay, so we had a question from a viewer. I read that one of the differences with this is that you get more contagious, not less. Do you know if that is true?
I'm not sure, like when, at what part of it are you more contagious than?
And I'm not,
Yeah, I
that
don't
is
think
how the
clarification is there.
question was written, so I'm not sure.
Repeat that again, please.
I have read that one of the differences with this is that you get more contagious, not less. Do you know if that is true? So I'm assuming more contagious with COVID.
As in how easily it's spread, yes, compared to other diseases.
Yeah, this disease is more contagious than influenza, but it's not as contagious as measles. And that's the problem with this, is because it's so far more contagious than influenza, and we always see how many cases we have of influenza in this country every year. This is just magnified why it is just simply more contagious than influenza. But that's the best I can do, sorry.
All right, so then she did submit a clarification, pre-recovery, stating that it's more contagious pre-recovery.
But yes, that would go along with it, right? The number of people you infect with this, as a member if you had influenza, is higher. So it is more infectious.
Thank you. Okay, so with that, we don't have any other questions coming through from viewers right at this moment. Is there anything else that the panel would like to add?
I have a couple of public health things. Contact tracers. If you ever get contacted by a contact tracer, please be truthful. We ran into a big problem where people just flat out won't cooperate with our contact tracers, and so they're trying to figure out who's been exposed, and people just say they were home all weekend when they were actually on the mountain with their whole family. And so we've had a few flares from people just not being truthful. So.
And if everybody will just buckle down and do your part by wearing your masks. I know that you're all tired of this, but believe me, nobody is more tired of all of this than we are. All of our days and between shifts at work, I mean, we're dealing with this and trying to learn more about it, so we wish that it would go away as much or more than anybody out in public.
Because we are truly having a surge in our county. There's no doubt about this. We are pushed ahead of the pack, and we do not wish to be ahead of the pack of this, so please, social distancing, masks, and contact tracing. The reason we need contact tracing is to halt this. The other outbreak we had, we caught that one early enough, so we got far less numbers because people cooperated with the contact tracing more than the second outbreak.
And if I can just emphasize once again, like everybody has said, just please, 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 social distance, wear your mask. I mean, as much as you can. That's the thing that's going to make it so we don't have 20 people on our 5 ventilators at the exact same time, where, you know, we then don't truly have the resources because we have too many people who are ill and we don't have enough personnel to be able to take care of them. So please, 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 you know, as a plea from, you know, the medical team.
And talk to your children, like as soon as they walk off that school grounds where they don't have to have that mask on, you watch when you pick up kids, they're pulling them off and sticking in their groups. Try to encourage your children to leave the mask on if they're in their groups of children. Because if you watch during pickup time, the masks come off as soon as they leave the property, and they're congregating in large groups. So try to keep your children from exposing themselves.
We talked a lot about masks and things today, but don't forget hand washing multiple times a day, please. Dr. Chu talked about surface cleaning, which is important too, but hand washing is probably as important or more as mask, or more.
So one other question is, can you explain the difference between isolation and quarantine?
Yeah, isolation is if you actually have the disease, you've been tested and you're positive, then you're in 10 days of isolation. Quarantine is if you're exposed to that person, then you're watching you to see if you develop the disease. That's quarantine. Unfortunately, you can start in quarantine and end up in isolation. So it depends if you develop the disease or not. Quarantine is always 14 days, because we've had people literally develop the disease on day 13. So that's why you have 14 days. The isolation has been dropped down to 10 days if they have the symptoms have gone away.
So do you think taking supplements for your immune system is helpful? Are they helpful in the treatment of COVID? And I know we've talked about some of that before, but especially, I guess, again, going into flu season, what are your thoughts there?
Not treatment, no. You can't treat it. There is, if you want to help your immune system, low dose of vitamin D, 25 micrograms, will help your general immune system. Because there are some studies out because of this outbreak. If you happen to have low vitamin D, people that live in northern climes are more at risk of having more severe disease. And so things like that. There's some things that maybe some zinc supplementation, as long as you don't overdo it, might improve your immune system. But the magic elixirs that were promoted in Texas are not effective.
Thank you.
Would you guys agree with that?
Yeah, plenty of rest, that certainly helps your immune system.
Yes.
Hydration.
Hydration. Yeah, sleeping 7 to 8 hours actually improves your immune system.
Okay. And this is a random, not COVID-related thing, but it was pointed out to me recently. So if I ever call people back, I have a 7-month-old son, and he farts a lot. So let me just point this out to everybody. My husband started laughing hysterically one time. I was on the phone with Dr. Johnson. He was like, "I'm pretty sure everyone thinks you're passing a lot of gas." So I just want to put that out there, that if I call you and you hear farting noises, it's not me. So just, you know, while we have the audience right now, I would just love to set that rumor to rest.
So
Thank you.
why is your child so gassy? What are you doing?
He's just a really loud farter. I don't know how, just every time, like, you know, and he's tiny, so it's adorable and cute versus, you know, a full-size adult. It's not nearly as cute, but, you know, when they're that tiny, everything they do is just adorable.
Well, it's your first child, too.
That's true. Probably second one, I'm like,
Okay, well, thank you, Dr. Chu.
Just wanted you know, while we have the audience, just put it out there.
Do we know yet how long antibodies last in a person who has had COVID?
The maximum so far is probably 3 months that we're aware of. But once again, we're so early in the disease, we'll see. A year from now.
The last I read is that you could pretty much count on 6 weeks, but beyond that, no good data, and it probably starts waning after that period of time.
Okay, so that really, I think that concludes everything for today. Any final thoughts from our panel this morning? Okay, so with that, thank you everyone for joining us. As always, if you have additional questions that you think of after we've finished the Facebook Live today, please feel free to submit those on our Facebook page, and we will do our best to answer those questions as quickly as possible. As mentioned, please do your part by staying safe, practicing social distancing, wearing your masks, and help play your part in keeping our community safe. Thank you, everyone. Have a great day.